Okay, thank you. Okay, so do you guys you want to go? I'll let Susan introduce herself first.
I'll share the screen so you can see the PowerPoint. Oh, okay. Welcome, everybody. Thank you for attending our session. Kayla and I are very excited to share with you some of the adventures we've had in the last few years of creating a young women's group. And we just wanted to share a little bit about what that journey has looked like and some of the things that we've heard, and then welcome discussion from you all to join into the conversation. So I'll start by introducing myself. My name is Dr. Susan Brasher. I'm an assistant professor at Emory School of Nursing. And I obtained my PhD in nursing, but specializing in autism, neurodevelopmental disorders. And for the last several years, I've had several grants that have focused on the transition from childhood to adulthood and what that looks like, working with actual young adults with autism and other stakeholders as partners. So not so much as I'm the researcher and they're participants, but we work side by side together to identify some of the challenges and what we can do about them. Kayla?
Yeah, and I am Kayla Rodriguez. I am Vice President and Chief Ambassador of Autistic Self-Advocacy Atlanta, or ASAA. We're basically an affiliate group of the Autistic Self-Advocacy Network. We used to be the official ASAN chapter before we became an affiliate group, but we're still very much affiliated with ASAN. We speak to the heads of ASAN on occasion. So I've been part of ASAA for about a few years now. And then the idea for this group, actually, Susan was doing something for Spectrum, and I was noticing, like, I attended because, I got my start in Spectrum, actually. Even though Spectrum, and I respect the people there, even though I'm no longer part of Spectrum, I do respect, Claire Dees and the people there for the most part. And I do credit Claire Dees for my start. So I attended a Spectrum event where Susan was a part of. And I noticed it was mostly, like, I think it was about a transitioning to adulthood or something. Mm-hmm. And this was like 2 years ago. And I was noticing, like, it was mostly boys. I think me and Susan were the only woman there, and I was the only autistic woman there. And so I was like, what about the girls? Why can't we have something for girls? So me and Susan met up afterwards, and we discussed about this plan, this idea of having a strictly women on the spectrum, women on the spectrum group. And because we feel like, as we're about to see, that women on the spectrum are really misrepresentative in both media and in studies and just in society in general. So I just wanted to get our struggles and, like, just have a social and support group about women on the spectrum, really. Mm-hmm. So yeah.
So we started a month and to talk about the transition to adulthood, but then also just in general being a woman on the spectrum and adulthood, and what were some of the unique challenges they faced, and then what could we do about it? Is there something that we could look to future projects to develop that? For example, right now we're in the middle of creating a mentorship program as a result of what the women were saying, that they wanted a mentor that was not on the spectrum. And so those are some things that we're doing to address some of the challenges that they're raising. And then in the meantime, we've just developed into kind of a support network, as Kayla has mentioned, and it's kind of blossomed from there.
Yeah.
So as Kayla said, how this started was originally I wanted to hear the perspectives of everyone on that transition, but Kayla made it very clear is that women are often overlooked and underrepresented in research and in discussions in general. And so she wanted her voice and all the other women's voice to be heard, but not only just be heard, but really to focus on it. And so it was kind of like the boys have had their time, right, Kayla?
Yeah, definitely.
It's our time now. And so I said, okay,
yeah,
let's do that. So then we focused just on the women and It's been really great in that they've been able to support each other. And a lot of it was just reaffirming, like, you're not alone. So somebody would say something in the group, like, I always, like, I'm exhausted. I feel like I have to pretend to be somebody else. And I have to, do this to fit in, and it's exhausting. And then other women would chime in and say, I feel the same way. So a lot of sense, it was a lot of just reaffirming, like, what you're struggling with, you're not the only one struggling with. So a lot of people identified some of the struggles they had and were relieved to hear that other people also were dealing with it. And then in some cases have been really great at telling them, like, what helped me, like sharing with them what helped them. And so that's been really great with, like, coping and mental health and other things that we've been talking about. So
Yeah. And like, it's, and like we relate to like what Susan just said, like women, people on the spectrum, especially women, like mask, which is basically hiding their autistic traits, and to try to fit in and everything. That's something I really did as a child. So just to hear from other women, like they went through this, they do the same thing, and like they also struggle with this or this or that, has been really helpful.
mhm.
And it has helped me personally just to know, like, look, like I'm not alone, and like I'm not like so weird after all.
Right.
And as you see, like when it's women, it is, autism is different for women as it is for men.
Yeah.
With like, like because it's underrepresented, most of the studies on autism is male focused, is on the media is mostly straight white males, so and then
Yeah.
we also focus with a lot of gender specific stuff like periods and all that type of stuff. And
Mhm.
I just was curious to see how autism, like autistic women go through daily struggles that most women go through, but also just are specific to women on the spectrum. So yeah.
Right. So originally, so this still is currently funded through a Patient-Centered Outcome Research Institute award, which is really all about, it's research done differently. It's partnering with stakeholders and patients and anybody who knows anything about a particular topic. And this was particularly autism transitioning to adulthood. And so we met monthly, and we would provide pizza and some snacks, and then we just kind of sat around, and each month we would identify a topic that they felt they wanted to talk about. And so certain ones came back up again. Mental health tends to be a reoccurring one because there's some, it seemed pervasive through our group that there was a lot of depression, anxiety, suicidal thoughts, and things like that. And so they wanted to talk about what they were feeling. Sexuality has come up quite a few times, and so we've talked about that as well, and just been supportive and inclusive of that. And sleep challenges, I think, coping also is another one. Um, so yeah, so I think I like the slide. What Kayla at the end put here is that we come together to support each other, and kind of say that you're not alone. You're not so, like Kayla just said, you're not so weird after all. You're not the only one feeling this way. And then in this process, while we're kind of, I don't want to say business minded, because it's more like we have a mission to identify the challenges and how to help them. But at the same sense, we're making friends together as well. So we have a really good group of supportive women that started off just a handful that we had that would meet. And then now, every month, not the same people come back necessarily for whatever reason. They have things that interfere with life. But we've now, I mean, we have more than like 50 young women that have come together. And originally in person. So in person, it gets a little crazy when we have too many people, and we learned that. But now that we're on Zoom, we're able to handle that a little bit better.
Yeah, and like the things that the topics that Susan just mentioned, like that's exactly stuff that I go through, like mental illness, like I'm gay, like the stuff that like, and I also have sleep problems. So just to know, like I'm not the only person going through this, it's just been really gratifying. And to know that a lot of women on the spectrum in our group go through that as well has just been so helpful. And yeah, it's been great.
Yeah, I think, and that pretty much covers it. We at one point we had 2 transgender women that were part of the group. Now we mostly just
Oh,
have 1 reoccurring transgender female that
mhm.
participates in the group, and that's been, and from their standpoint, really important as well to fit into a group that could talk about, some of the trans-specific kind of challenges that they were encountering, and for us to be supportive of her.
Yeah, yeah, we're definitely, and we do want to include more like trans women and also non-binary
Mhm.
uh people too, because basically I know non-binary is basically like they're technically, they're not women, but basically this group is, how the Autistic Women and Non-Binary Network, it's kind of like the same thing, which I do want to work with the Autistic Women and Non-Binary Network in the future,
Mhm.
but basically this group is like not for boys. That's what I'm saying. Because again, boys have all the spotlight and all the attention, but it's time for us. You know what I'm saying?
Yeah. So this goes through end of November into December, the grant does. And we've already, as Kayla mentioned, we've included Claire D's through Spectrum from the beginning with this, and we advertised through her website for people to join the group. And Claire has made an agreement that after this funding is over, that she's going to help continue to sustain the group going, because that was a big
Oh,
concern of ours is, what do we do after this, and how do you keep that going? Although I will say right now, it's not costing anything to do it through Zoom.
yeah.
Before it was, we wanted to provide food because it did require them to get transportation there and things like that. And so, but now in a way, that's one good thing about COVID. We've discovered takes nothing but an hour of your time.
Exactly. Yeah.
Yeah.
But again, eventually we will. The COVID, hopefully, everything. I mean, I'm not saying everything will go back to normal, but we will hopefully eventually we'll be meeting in person again and stuff.
Mhm.
So we
Right.
have to find a way to continue once the grant ends, at the end of the year. So I
Yeah.
do want the group to continue. We're gonna find, I know it will, so I do want to stay involved in it. I know we will find a way. So is that everything?
Yeah. Let's see, Sidel, you have a question.
I got a question. How would I direct somebody so that they could join your group?
So right now, like I said, we are on as the Spectrum website. So if you go to ATL Spectrum's website, you can click on, there's a women specific tab. But there's also the Facebook page. We also have a Facebook page for anybody who wants to join.
And I
Um,
will put it
Okay.
in chat right now. Let me
yeah,
just
there you
find
go.
it.
So those are 2 ways to do that.
Excellent.
You're always welcome to send me an email or introduce me via email if you want, and I could share my email through chat too, and we could add them. We have our Facebook page, but not everybody's on Facebook. So then we also have
Right.
a email listserv that goes out every month to say our meeting's happening, and that way they can join that way too.
All right.
I'm putting the link to the Facebook group in the chat right now. So just give me
Okay.
a minute. I will also
No,
say
now.
Yeah.
I'm also going to be putting a link to Autistic Self-Advocacy Atlanta as well, which is the group I am a part of. This is the link to and the women's group.
Facebook, yeah. And then we have our women's group that's a little more focused on the challenges and problem solving some of these challenges. And but we also found that we have some really talented young women in our group that are really great artists and really wanted a place to showcase some of their art skills. So Claire Dees
Cool.
has done a separate art women's group that meets like a craft social. And so that's been really, when it was in person, it was actually, Claire's just phenomenal. In case you don't know Claire, but if you do, she's phenomenal. But
Yeah,
she
she is.
opened up her basement one Wednesday of the month, and all the women would come over, and she'd provide all the craft supplies. We were able to help support that through the grant also, but Claire would have done it either way, I'm positive. And she had all these crafts, and they craft together and they kind of talk, and sometimes sometimes just being in the same space and just feeling like almost like a tribe or like a community. Like you you get it. You don't even have to talk. You just get each other, you know? Yeah.
Yeah.
So that's also available.
And that idea was completely Claire's. And I really appreciate Claire doing that. And it's definitely because there was a need for that to happen. So I definitely appreciate Claire creating that and happening. I know that for sure will continue once the grant ends. We're definitely continuing the main group, but we're also, Claire is in charge of that group. But I'm really happy that she created that, and that's just awesome.
So sometimes the same women go to both, and sometimes we see them go to certain women are not really so much interested in talking about the problems or the challenges, and they just want to be with like-minded, similar people, and they just go to the craft, or some go to both, or some just come to our group and don't go to the craft. So
yeah, so that craft group is really awesome because, you know, it definitely you know, it's good that both exist because it satisfies different needs. And you could find on Facebook, Claire does post information on the next craft night. So I think right now through COVID, she's also doing it through Zoom as well. She's doing it like everything is through Zoom, both the main group and the craft night is Zoom. Originally it was in person. Our group meeting, the main group was in Norcross, and then the craft night was in Claire's house, but now everything is because of COVID is in Zoom right now. So, but eventually it'll be back to in person.
All right.
So apparently this is going to be like more of a discussion as well. So if anyone has anything to say, please, any questions, any comments, just let us know.
I do have a question.
Yes.
How important or is it for hormone balance for a female, whatever age, and when hormones come into interaction? How important is the balance of hormones in their body compared to what's going on in their brain already?
Well, I will say, Kayla, you jump in on this too, but that is something that comes up that was, again, unique to the women, is that I think everybody remembers going through all the estrogen and all the, you know, and then not, you know, from what we found is like, we saw, like what we were hearing is that like, kind of like, it's hard to stay like in a middle regulating stage. So they often spike up here, and then it's just exhausting, and then they crash, you know? And so that's what we're hearing, is that there's a lot of like ups and downs, but it's hard to stay in a regulated mode. And the hormones, that time period was particularly challenging. Kayla,
definitely. Cause like, I know personally for me, like when my hormones are out of balance, like due to my like menstrual cycle, it's just like crazy. And I don't know how, like, that's one of the things I was interested in, like, how do autistic women go through like periods, you know?
Right.
You know, so like, I mean, I never think that autism is a bad thing, and it's not. I'm really proud of my autism, but you know, like everything else in life, I believe it does have a little bit of challenges.
Sure, because it's chemical too. Yeah,
I mean, like autism is definitely not a bad thing. It's a great thing in my opinion.
Right.
And I'm proud of it. But like, so I was just like, some challenges like is mainly for me is sensory, but like I was just curious on how like how autism, if it affects like the menstrual cycle and everything like that.
Right.
And
another layer, wouldn't you say, Kayla?
It's a layer.
Yeah, definitely. Yeah. And I was also interested in how like autistic women, they go what challenges do they have because of their autism, and also what are their strengths, you know, like what are, you know, what do they perceive as challenges, and you know, what are also their strengths, and like,
what's
you
your
know,
superpower?
I agree. You know, that's what Greta Thunberg said that. Is that how you say her name?
Yeah.
I do agree with that. I agree with that, the autism. I mean, I don't know if I agree. I mean, I kind of agree that it's a superpower, but then it's also like, oh, we're more special than everybody else, but like we are special. Kind of like, I don't know how I feel about that, but
yeah,
I agree. We're unique. Let's just say that we're special.
Yes.
Oh, we do have a question. Can women not on the spectrum get involved and support these groups? I think yes, right?
Yeah, I mean, I think originally it was that, and that's that's where we're heading now. Is originally we were wanting to keep it just women on the spectrum to kind of relate and kind of feel engaged with each other, and then the conversation started happening. Like, I wish we had mentors, and then we said, okay, so what kind of, would you want somebody on the spectrum, or would you want a neurotypical person? And then they said, we'd rather neurotypical mentors. So we're in the process right now of creating. So I'm a professor in the School of Nursing, so we have a lot of nursing students that, especially right now during COVID, are not able to go to the hospital. They want to help people,
Right.
but they don't know how. So we thought about bringing the nursing students into it. But yes, is it Hallie or Haley?
It's Hallie.
Hallie.
Yes.
Yeah. So Hallie,
Okay.
if that's something you'd be interested in joining, send me an email and we'll definitely, or if, is that what you were thinking, or were you thinking just to be part of supporting? Or, I mean, that's a different type of support, the mentoring piece.
I enjoy the mentorship piece and would be interested. I just graduated from Emory last year and was a part of the business school mentorship
Oh, okay.
with the
Yeah.
young
That's
adults.
what up.
So yeah.
I thought you were going to say you're one of my students. I felt awful. I was like, I don't even know. I don't recognize you. I do have 200 students though, like every semester. So.
Yeah.
Okay, great. Yes, feel
Thank
free.
you.
My email address is in there, and just let me know and just say you want to be part of that mentorship. And I'll send you a link to, I'm starting to collect names through a Google form, so I could just keep a running tab of names. And we're getting that started right now, because right now more than ever, our women are saying they need support in a different way. All of our women have a therapist and see somebody, but that's not really what they're seeking in the mentorship. What they're really just seeking is like, I'm feeling this way too, but it's not, it's different, right, Kayla?
Right.
The type
Yeah,
of
it is different. And if you want to email Susan, it's in the chat box. But yeah, personally for me, I do want a mentor too. I think I would like both a not neurotypical and an autistic one, because like I want more insight in the neurotypical world, but also like how does an autistic go through the neurotypical world? You know what I'm saying? So personally, I would like both an autistic and a non-autistic mentor. But yeah, definitely I would like a mentor. Do you think we should, like, I know Mentra, ASAA is working with Mentra. Maybe we could have a collab, maybe have a collab there with Mentra. Have you heard of Mentra?
Yeah.
Yeah, that's for Dilica.
That is something we're doing for our mentoring. Part of the Google form is just asking some questions about you, for example, Hallie, just because we to our best of our ability, would like to pair you with somebody that has similar, like if we have somebody that's like really, like I can think of one particular person that's like super into like Disney or super into movies or Star Wars or whichever, like it'd be nice if that mentor knew, because that's a reoccurring theme they want to talk about.
Right.
Yeah.
But
I would like someone into video games personally.
games,
movies too.
And maybe Xbox specifically, right, Kayla?
No, PS4, PlayStation.
I remember that other day there was a little bit of back and
there was
forth.
console rivals.
Yeah.
But yeah, basically that'd be cool. I am looking forward to the mentor like type of thing, because like I do need like I also want someone, like I think Disability Link would have also this, but like I need like more independent skills training. So maybe like a mentor can provide that for me, because I never want to live by myself, but I do want to become more independent. Like I remember Susan, there was like Emory was doing, but I couldn't do it. Like you were doing like a health
The healthcare
thing. Yeah, I couldn't attend, but I would like to do something like that if we could have like mentors doing that, or just teaching us like general life skills. The thing, my worry is, do we have to pay for these type of things?
No, that's
okay,
gonna
good, because I don't have the money.
No cost. No, it's
No,
gonna
good.
be
I don't want money. I don't have. But that's the thing though, because we're trying to figure out like, because that will cost money. It's just that we, of course, we can't pay for it. But that's what we're trying to figure out, is like when this grant ends, like where are we gonna go next and everything like that, and how are we gonna get money, and like, because the Zoom thing hopefully won't last forever, right? So that's what we're trying to figure out. Claire's definitely gonna do her thing with this craft group. I mean, I definitely still want Claire to do that. I just want to be, involved with the group still, and see where it goes. And I do definitely want to expand more too after COVID, because right now we're just basically focusing on just keep having the group meetings. But there were talks before COVID went down about expanding the group. I think like Tony Thomas from Emory wanted to do some near her area, because basically we're based in Norcross, like Gwinnett, and we did want to expand to other parts of Atlanta. So
yeah, that's been one benefit of the COVID. So where our group meets in Norcross was, we have space that was given to us through Connecting Dots, a therapy clinic, and who also works with Spectrum. And so she allowed us to use her clinic after hours, and it's a really great space, and it's been phenomenal. It was free, because otherwise we'd have to find a place that would, it would cost. But that's one thing, is since it's outside of the perimeter, there were some people that really transportation was an issue, and that was a barrier to getting out to us. And so unfortunately we missed some people doing that. And COVID now allows people, in fact, one of our young women just recently moved to New York and was really missing our group. Yeah, and she's in New York right now, and we were all hearing what she's going through in New York right now as a woman with autism. And but that was a great way for her to reconnect, because she was really missing our group to feel that connectedness.
Yeah, and one thing that's like, I originally thought like we would just have people like in our 20s, but some of our members are kind of older than that.
We originally were focusing on that like transitional age, and that's what really the focus was. But then at the same point, Kayla and I we want to be inclusive, and so we didn't want to, if somebody was struggling to fit in someplace, we didn't want to say, no, you're too old. And so we at one point had somebody in their 60s, right, or 70s, right?
Yeah, I think so, 60s. And the thing is like they didn't really have a problem. Like our members didn't have a problem with them, and they didn't have a problem with us with the age. I think they really got along really well. The person in New York is older, I know for sure, but she still misses our group. So that's what's incredible, I think, because we all relate to the same struggles and the same things, and the same like highs and lows of being an autistic woman in this society. So
and in a sense, it's been really interesting to have older people in the group, that it's almost been like, in a way, like an unspoken mentorship, to say, like Laura, for example, is highly independent, and she has an apartment of her own, and she has a job at Marcus analyzing data. She's the only person on the spectrum at Marcus and Autism Center. And so she says a lot to the groups of like, this is what I was going through in my 20s, and this is how. And so it was kind of really interesting, right, Kayla?
Yeah, definitely. We also have a question: how racially and ethnically diverse is the group?
So our group varies a little bit. So we do have some variations, but what's come up in the last year is that we started thinking about, just like how we broke off for the women's group, we also wanted to think about how can we break off for a racial and diversity group as well. Because some of the things that I was hearing, not so much Kayla wasn't at part of these, because it was the men and women together, that how, especially for our African American group, and then for our participants, we're saying that that's an extra, like, very different, and so they also wanted to feel even more so included, because you might not get that if you're speaking in a group of all white people.
Exactly.
And so, I would say our group, it's not the most diversified, but what we're working on is maybe creating a separate group that's all going to focus on racial and diversity, right, Kayla?
Yes, and we were going to do that again before COVID struck, but there are some people of color and women of color in the group. But I also, in addition to having this separate group in the works, I do want this women's group to be more diverse in the future as well.
Right.
Because again, we want to accept all women on the spectrum, and I mean, obviously we can't be like hateful beliefs and everything, but all women should be welcome.
Mm-hmm. And if anybody wants to help with that, that's one thing that Kayla and I have been talking about for like the past year, to have an extra focus on that, an extra group on that. And between the two of us, we were just like, I don't know if we have enough bandwidth to do this. And Kayla does so much already. That's always the balance, is trying to not to burn Kayla out sometimes, because
sometimes, yeah, because I had I had an internship, and then I have ASAA, and I had like speaking engagements and stuff like that. But I do want to.
Phenomenal advocate, but you're always like, that feeling of just like, if you give so much to everybody else, then what's left for you? So I'm always like,
exactly,
right.
That's how I feel. Yeah, so. But I do remember that topic, and I do want to get back to it. But again, I feel like COVID has just like stopped everyone's plans, including our own. Unfortunately, like I remember like the month COVID, like really the pandemic, it was called a pandemic. Like ASA had like several plans. We had like a women's panel that got postponed to the end of summer.
Wow.
So yeah, so when everything gets back to like a normal where we can like live our lives again. I know some places are reopening, but we're not fully there yet. Once we are, then we'll focus on that. And my internship actually ended early, so I'm trying to figure out my next steps and everything. So yeah, does anyone have any questions? Any other questions?
Dr. Stephanie Pearson, are you presenting also in this? I thought your name looked familiar.
Hi, no, I'm not presenting. I've been involved with the conference, the virtual conference. I'm the clinical director for the Office of Children, Young Adults, and Families at DBHTD.
Oh, hi. Yeah, I spoke at DBHTD.
Yes.
Hello.
Yeah, DBHTD. So Brianna Kelly is
I know her.
Yeah, she and I are working together on the development of the crisis continuum services for young people on the spectrum.
Oh,
so
great.
She told me about the conference, and so I've been very pleased to be able to be a part of it. It's been fantastic.
It really has, hasn't it?
Yeah, I haven't heard from Brianna in a bit. I should reach out to her and say hey.
Yeah, she's like you. Her calendar is crazy full, but she's always extending herself. So
yeah, she's cool. She's cool.
Yeah, for our racial and ethnic diversity group, how that originally came up was actually in the boys, our African-American men, who were saying, especially some of the safety issues that they were encountering with law enforcement and with just even going to the hospital, or, firefighters, emergency workers, people not having an understanding of autism, and, making a lot of false assumptions. And it's really, that was one of the things that came up when we were asking about the transition to adulthood. What's the biggest concern? And, for me, I'm from the healthcare field, so I assumed everybody was going to say the healthcare transition, but for some it was employment, some it was this, but for our African-American families, it was safety was their biggest concern.
Sad but true.
There's so much, the negative cultural stereotyping that goes on, the implicit, all that goes is highlighted when you have a young person on the spectrum that folks don't understand, especially if the person's not verbal and how they listen. And so they think, oh, this is a very dangerous person, and they respond of danger when it may not even exist. And so that's why I was just curious for the women's group as well.
Yeah. So when we thought about our group, that's where it first came up, from our families of men who were sharing these stories of how their behaviors, which were autistic, were misread as being dangerous or threatening, and how it was really a safety threat to their lives. And so when we thought about the group, we thought, should we have that? And we're still thinking on that. Should it be guys and women, or should we again separate again? Because it might be different, especially for our African-American men. We don't hear that as much from our women, right? That their behaviors are misread as being threatening or this, or, you know what I mean?
Yeah, I think we should have it separate for the men and women, because again, I think because, it's different for men and women, and like men, like, if you because men, like most of the police brutality cases are African-American men.
Yes.
So, I think I mean, like, I'm not saying African American women don't get police brutality, but a lot of you, if you see, are African American men. So I think they have an extra, like, they're extra more in danger than the women in that regard. Does that make sense?
Mm-hmm.
Yes.
It does. I was just curious, would the actual participants or potential participants be surveyed first to see what their preference is? Like if they prefer to be separate, or would they prefer to be together as a homogeneous racial group as opposed to?
I mean, we
Yeah.
could
You
do
have
survey.
breakout rooms.
Yeah.
Mhm.
Or maybe we make it, and we can do a survey, or like you said, breakout rooms, and then you could choose. Like we don't have to you have to always be with the men or the women. Choose which group you want.
Yeah, you could choose. Yeah, I like that. Yeah, you could choose whether you want to be like. I mean, for me, I would have it be separate, but again, it's up to everybody, you know. And I would like to have that choice, but. Yeah, I think there was some talk. I remember last year, Susan, there was some law enforcement stuff going on.
Yeah, we
I
did
hope we can revive that, because personally, like, I've had some encounters with the police, and most of it was because of my mental illnesses, you know, because I was suicidal, and almost all it was all scary. Almost all of it was scary. They even handcuffed me once. It was just,
Oh my God.
yeah, they handcuffed me so tight, and I'm like, and I think my most recent one, it was like, I think like my friend came over and they were just rude to my friend. It was just like crazy. Part of my language, but you know what I'm saying? Like, so we need to like really, and I was like so scared, like, because like why would they're saying like the police had like guns in their holsters? I'm like, why would you have a gun in your holster with like a suicidal person? Like, that's what you know what I'm saying? But
yeah, that was part of we barely scratched the surface, but that part of this grant, we were able to get together young adults and with autism, and then different like firefighters, EMTs, and police officers, and we brought them together, and we did what we called like a reciprocal learning. And so for the police officers to say, when I put my hands in my pocket, it's because I'm nervous and my repetitive behaviors are acting up. I'm not reaching for a gun, you know, and for but also at the same sense for the young adults to see from the police officers, like, a lot of what I see is this. So when I see that, I think this. So we tried to break down some of these misconceptions and barriers. And, you know, we learned our police officers, and they even did like a scenario, and we were kind of like, how's this going to work? But it was really effective, because even just like, what do you do when you get pulled over even, right? And so we all like, our heart rate would go up, and we're so nervous, even though we didn't really do anything. But so for autism, it's magnified by 100.
Higher.
Yeah, it is. Trust me, it is. Like
you're tempted to just take your seatbelt off, maybe get out, and then you can't do that. And so we did that for one session, but that needs to be a more prominent thing that needs to roll out, but it was really helpful for everybody to see each other's perspectives.
Trust me,
there should be training. They should have training.
So that was a big eye-opener for me, because, you know, as a healthcare provider, I'm required to do continuing education every year to maintain my license. Domestic violence, HIV, things like that. And I assumed that police officers had a pretty good training and it was reoccurring, and that's not the case. For autism and mental health, it's once over their entire career. I had no idea. So to learn that from them was really shocking. And then that makes me want to also get more of our policy people involved to make that change, because that can't be it.
And
I wonder how that varies across jurisdictions, like the smaller, more rural jurisdictions probably have fewer resources, people who aren't as well trained as somebody who might be in a major metropolitan area.
Exactly. And what's in the training, right? Is that if it's just a bunch of like jargon, but it doesn't really get at the root of what autism is and how the symptoms manifest, then it's like, if it's just restrictive repetitive behaviors, if you don't know what that means, that doesn't mean anything. Those are words, you know?
And there's to me, like, no offense, there's just like a lot of things wrong with the police. Not trying not to be controversial here, but that's what I think. Like,
it's a mentality. It's how they got there,
like
why they're there. A lot of them.
I know. And then like if you heard about Ahmaud Arbery, like they didn't like do anything. Like they had the kid. They only arrested those guys because we spoke out about it, not because of But the controversial opinions aside, one thing that could change is obviously I think they need to be more educated on these type of things.
Yes.
And I think we should continue those education sessions. I personally would have loved to. I don't know why I missed that session, but I think we should. I think that we can continue with that. I'll try to write that down to make sure we continue. We have a question. Do you also provide this type of training to healthcare workers?
So we just, again, through this started, hearing from, so I'm a pediatric nurse practitioner as my background. And so, but I was hearing from my adult nurse practitioner friends that they don't know how to care for a young adult with autism. And so in particular, I have one that works in an adult emergency department. And so when they come in, she says there aren't any policies to help them navigate what should they be doing. Wow. And so oftentimes they restrain them and they, give them medications to sedate them, which is like the opposite of, so it's like they make it worse. So, but after hearing that, our group started thinking about how we need to start training. We're training our nursing students so that they will be better prepared. And then now we're training our nurse practitioner students. So what we now started doing is that we're starting to train our young adults, which is what Kayla mentioned earlier, where we offer healthcare trainings for them to be better healthcare consumers and advocates. And that's something that's just like how to call and make an appointment, or where, things about your insurance card, things that we, kind of take for granted. So, and at the same time, we're training our nurse practitioner students, and before COVID, we were going to bring them in for an actual visit together so that the adults can practice giving their history and telling their meds. And our nurse practitioners can practice asking questions for a history and doing an assessment, atraumatically. And so that is what we were just doing right when COVID hit. So now we're trying to think, what does that look like virtually? It's not the same to do a healthcare visit virtually, but we're still hoping to attempt it.
Yeah, and I just want to share real quick. This is kind of ties into what you were saying, Susan.
Mm-hmm.
So as you probably Susan, I was recently hospitalized and for suicidal attempt. And the reason I'm bringing this up was because I went to a place called Summit Ridge. And the reason I'm bringing this up is because they really didn't know, because what you said, Susan, about if they act out or they sedate them with a shot, that's exactly what happens at Summit Ridge. There were multiple times, it was so loud and it was so chaotic. People were trying to fight each other. People were, there was so much chaos there that I really wanted to, I was going to explode. But I couldn't because I'd get the shot and stay there longer.
Yeah.
Oh my God.
And then the staff there didn't know how to treat an autistic. They were rude to me. They yelled at me sometimes. They just were rude and people there, it was just so loud. And part of autism, my autism is that I'm sensitive to loud noises. I have sensory issues with loudness. So what you just said, Susan, just really brought out the point. I am trying to press legal action against Summit Ridge. Please don't go to Summit Ridge if anyone is suicide. If your kid is suicidal and someone just don't go there.
Well, and Kayla, that's something we heard from some of our other participants. I won't name them, but that some of our other people have had similar, and they were different facilities. So it's not even. It's not just Summit Ridge. It's it's pervasive. It's all the mental health. So one of the things they're always taught. I teach in North Star. We're a program for EBD, and many of our students are on the scale, that different scale going on, autism and all. But they're always saying they cannot perceive facial looks. They don't know what emotion is. Well, what about the opposite? Why aren't we taught that
being nonverbal doesn't mean that you're not cooperating. It just means you're nonverbal. So there's a lot of miscommunication on the neuro side.
Right.
And it's beyond me how we're treating people.
Right.
Exactly. Yeah. And I was just thinking of a thought, like, what if, like, because when you're in a mental health facility, they take away all your technology. What if you're a nonverbal autistic and they take away your talking device? Because your communication, I don't know if assistive talking device.
Right.
Like, you know what I'm saying? Like, what if they do that?
The processing piece too, right? And that, and the anxiety and the processing delay is that if somebody says, well, aren't you going to do this? Well, and it's like anxiety goes up, there's a processing delay. And so, so that's when this started coming up more recently. We were already starting to put together our trainings for our nurses and our nurse practitioners, but then it almost like the mental health providers almost kind of, we're like torn now. Like we need to do all of them, but it's like, who should we prioritize? Right now, we're having some actual young adults that are going to the hospital for various reasons. And we had one of our own young adults that was COVID positive that was hospitalized. And so, so we had to shift our attention to healthcare training, because especially with COVID, they're not letting the parents stay because it's COVID. And I get that from a disease control, infection control part, but from an autism, researcher, provider, advocate, like I can see how problematic that is,
Yeah. So like, but trust me when I say Summit, I know like there's these problems in other places, but Summit Ridge is especially bad.
Yeah.
But I'm going to try to like do a police report or just like civil case. But anyway, but it's not just, you're right, it's not just Summit Ridge, it's other facilities.
Right.
Yeah. And that's why we need to have the healthcare training. I think a lot of places, not just the healthcare, not just the law enforcement, I think a lot of places need to be trained for people on the spectrum, especially like the workforce. And that's what Mentra is trying to do. If you don't know what Mentra is, I could do the website, but Mentra is basically ASA is collaborating with Mentra. My friend Jalika Kumar started it, founded it. It's basically like an employment. It's in beta, I think, right now, but it's basically like an employment thing for people on the spectrum.
She's a Georgia Tech student and had this as a project, and she developed a fabulous app of like, it's like a matchmaking for employment.
Yeah.
And so it's because it's also how your resume, right? And so some people, like I talked about, restrictive repetitive behaviors or interests, right? And so some of them have very focused interests. So it would help their employer to understand that like this is where they could shine. They will pour in 1,000% into this one area of interest. So you might not want to put them over here with this job, because if they're not interested in it, I mean, that's for all of us, right? I couldn't be an engineer, and it's not because I'm not smart. It's just I don't care about that at all.
Exactly.
I care a lot about healthcare, and I'll spend all my time learning about healthcare. Right,
exactly.
Kayla?
Yeah. And we also need to make sure, it's also like Mentor is great because like they also like try with accommodations and like, because a lot of autistics needs accommodation, example me. So like Mentor really helps with what identifying what accommodations you need, what environment of work that you could work in. It's just like really well, and it was started because Jalika herself has a brother on the spectrum as well, so she has a personal connection.
And Claire Dees, and we are going to help support that through this grant as well, is going to be hosting an employment event in the next couple of months. I want to say November, but
I heard about that.
But it's going to be bringing together employers and kind of sharing from an employer perspective who employs individuals on the spectrum, how it's been successful, how they've done that, and then also the employees to say, how, just to kind of shine a light to that in the employment space.
Yeah, can you let me know about that, or let the details?
She hasn't started advertising it, but we're just in the planning stages right now, so just keep an eye on that. But
yeah, I'll ask Claire about that. But we have like 5 more minutes if anybody has any questions
or any feedback, like things you think.
Where is everybody located?
What's that?
I'm above Blue Ridge. I'm almost at Tennessee.
Yeah, I'm in the Norcross area. Kelly, you're in the Beaufort area.
But yeah, one of the goals is to try to expand. Oh, you're welcome. One of the goals of one of my goals for the group going forward after we figure out like what's going to happen with it is to expand to other parts of Metro Atlanta. And I also want to work with the Autistic Women's and Non-Binary Network. You should check it out. I think I'll put in the link to the website. But I know someone I know Monique. She's awesome, and I've been wanting to talk to her. I've been trying to talk to her. She's a busy woman though, so I don't blame her. But I've been wanting to talk to her about like collaborating with our group, and maybe be a branch of this group or maybe a branch of the Women's Network or something. Because I think it'd be a good fit.
And they connected with us at Kayla, I shared that with you last year at the International Society for Autism Research.
Yeah.
She came by and saw our poster and was really supportive of it.
Yeah, I need to email Monique. She's also part of the women's panel that's coming up. I could also do the Eventbrite for that. Let me just find it real quick. But yes, Powerhouse Strong. We're gonna do a women's panel. It was supposed to be in March, but it has been delayed till the end of the summer, I think. Let me find the Eventbrite. There it is. And this is recorded. So yeah, August 29th, it says on here. I will be on the panel, and Maya, who you saw earlier, is also on the panel. Monique, I think her name's how to say Monique, will be on the panel as well. So through Zoom. So yeah,
that was just at the right when it started hitting.
Yeah, when it started to hit. Yeah, it was going to be at the end of March, but COVID.
Yeah, and we were going to have that at the Emory School of Nursing, hosted there, and we had a fairly good turnout, but then it got canceled. So maybe we'll see how we can do it virtually.
Yeah, it is. It's not canceled. It's just postponed, but we'll see. It's supposed to be August 29th, but we'll see. We still have 2 more months. So, excuse me. Yeah. Does anybody has any more questions or?
It's been great.
Thank you. Yeah. Okay. Doreen says there are 5 minutes left. We could leave or be transferred back to the main room. So if anyone doesn't have any more questions or comments or anything to add.
Just want to say thank you for the rich discussion. I really enjoyed it.
Thank you.
Thank you.
I learned a lot, Kayla.
Huh?
And Kayla, do you want to put your email address in there too in case they want to reach you?
Sure. What did you say?
Pretty well known. You could probably Google her and find it really easily, but you have to make it easy for the people.
Right. Taylor, did you say something?
Yeah, I said great job, Kayla and Susan. Thank you.
You're welcome. You're welcome. Here's my email. I'm typing it into the chat right now. Susan already put her email in the chat. So yeah, I guess that's it. Thank you, Susan.
Oh, thank you. And thank all of you guys for coming and supporting this and us. And if you have questions later, or I'm also open to suggestions, there's things that maybe we aren't thinking about. I mean, we've just kind of happened upon these things, and it's happened very organically. Like we had the group as men and women, and then Kayla said, what about the women? We said, okay, let's do the women's group. And so we might be missing something. So if you have any thoughts, please share them with us, and we're happy to see how we can best support women with autism.
Yeah, definitely. So thank you all. I think time is now up. So thank you, everybody.
Thank you.
Thank you.
Everyone, I guess we go back to the main room, Taylor, or we just
we leave the room or go back to the main room.
Yes, go to the main room, please.
Thanks, everybody.
Bye.
Thanks, guys.
Thank you so much.
Thank you.
Thank you.